suffer from a heart condition, and for the past 50 years, the American Heart Association has recommended pre-medicating dental patients with antibiotics. But as Dr. Paul Coleman says, the guidelines have changed, and he joins us this morning with the new rules and what it means for you. Thank you so much for coming in.
You betcha.
Interesting. I never actually even was familiar with that. But what did they have been, and then what are they now? What are the changes?
Okay, here's the deal. If you have some roughened pieces of your heart, whether it be a valve or something that because of disease or a congenital defect, the idea was that if you introduce some of the bugs that are only found in your mouth into the bloodstream, it could settle on these defects and cause an infection that's fairly serious. Okay? But there was never any conclusive evidence that giving these patients antibiotics before the procedure actually did any good.
And this was for regular dental or even cleanings?
Absolutely,
as well as
for cleanings.
Serious, intensive dental work?
Anything that involved any interaction with the blood. So any shots, any cleanings, anything that involved an extraction or implant placement. And the guidelines have really never been proven necessary. And I've always thought they were kind of a crock, personally. Because if you think about it, if somebody's got gum disease and they go home and floss, they're bleeding like crazy. So they're introducing more bugs into their system by flossing.
So what now?
The guidelines have morphed through the years. When I first was introduced to them in school 30 years ago, you had to have patients for days before the procedure and days after. They were most recently revised in 1997 to be one large dose an hour before the procedure. Basically now they've kicked out the vast majority of the people that are involved with this kind of a situation. As much as 10% of the public has to go through this regime before they visit me.
Wow.
Okay? Now, the problem with it is every single time you introduce a drug into your system, you increase the likelihood that you're going to develop an allergy to that drug. So you could take penicillin 100 times and develop an allergy to it at the 101st time. And that can range from a rash to cardiac arrest, okay? So this is not something you want to just routinely give to people if you don't have to do it.
Yeah, and so now there's actually, for people who do have to go through this, 10%, you actually have a list of ones that they no longer need antibiotics for.
It's the vast majority. So you should check with your physician if there's any doubt to you whatsoever. But people that have been taking it because of mitral valve prolapse is the most common one. You don't need to do that anymore unless you have regurgitation, which is a very specific piece of the puzzle.
Great, and you see the other ones right there, rheumatic heart disease, as well as the other three there. So some very important information, no more antibiotics needed for those certain conditions.
Check with your doctor.
All right, well, thank you so much. Some
You're
great
welcome.
information, as always. And if you guys like more information, always log on to fox6.com. Well, up next, we've been sailing away on a yacht. Oh, not a bad place to